The repeal of the Affordable Care Act passes its first test. We're asking what that could ultimately mean for patients here in Colorado. Also, we'll take a look at what's been done and still needs to be done in the final days of the state legislature. Plus, we're talking to candidate for governor Mike Johnston. I'm Ann Trujillo, and welcome to Politics Unplugged. Republicans celebrating in Washington last week after House Republicans squeezed out a victory to start dismantling the Affordable Care Act. But that's far from a sure thing right now. The bill faces an uphill battle in the Senate, where some moderate Republicans worry about the number of people who could lose their coverage.
Well, the Senate will write its own bill. I mean, that's the way it works, right? And so they'll pass theirs, we'll pass ours, and then we'll go to conference.
Now, the reality is we do not know a lot about the impact of this bill. It was passed so quickly. The nonpartisan Congressional Budget Office couldn't look at the costs, the savings, or even pinpoint how many people would be covered, which leaves us asking what this means and how it would affect each and every one of us. And here to talk about the impact on Colorado is Adam Fox. He's the Director of Strategic Engagement for the Colorado Consumer Health Initiative. So thank you so much for being here.
My pleasure.
I know this plan still has a long way to go, but I think a lot of people are in panic mode. Should we be worried right now?
Absolutely. This bill would really threaten the health care of well over 600,000 Coloradans. And that's just in Medicaid coverage alone. That doesn't even start to talk about the changes that would be made to private insurance coverage, which we've heard so much about lately because it would end the guarantee of coverage for pre-existing conditions. Well,
now that you mentioned the pre-existing conditions issue, that was a big issue this week. How people would be covered, if they'd be covered, the topic brought to light by ABC's Jimmy Kimmel when he tearfully announced his newborn son had a heart defect. Take a listen.
Before 2014, if you were born with congenital heart disease like my son was, there was a good chance you'd never be able to get health insurance because you had a pre-existing condition. You were born with a pre-existing condition. If your parents didn't have medical insurance, you might not live long enough to even get denied because of a pre-existing condition. If your baby is going to die, and it doesn't have to, it shouldn't matter how much money you make. I think that's something that, whether you're a Republican or a Democrat or something else, we all agree on that, right?
Pre-existing conditions, that really affects, what, a third of the population?
Yeah, there are estimates as high as 2.25 million Coloradans that have pre-existing conditions.
So compare these to what Obamacare provides and what would change if this plan goes through.
So right now, under the Affordable Care Act, nobody can be denied coverage or charged more for their health insurance if they have a pre-existing condition. This bill that the House passed yesterday would change that by allowing states to waive key provisions of the Affordable Care Act, and insurers would again be able to charge people with pre-existing conditions more. They wouldn't be able to flat out deny them, but they would be able to basically price them out of the market.
I know that we got some new numbers that show Colorado's feelings about health care right now. 60% say they want to keep and fix Obamacare. 23% want to repeal and replace. 10% just want Obamacare gone altogether. Is that what you're hearing from Coloradans?
For the most part, we're hearing that people are largely tired of this playing with their health care, and they want to see people in Congress work with the system that we have now and make some fixes to it to make it work better.
People are just tired of talking about it. What is it that, I mean, is there a dream plan out there? Is there something? Yeah, I mean, this is so individual, right?
I think ultimately the vast majority of the American people support everyone having access to affordable health coverage and the care that they need. And so there are a variety of plans that would get us there, and the Affordable Care Act has gotten us close, much closer to it than we were before. But there's still a lot of ground that we need to cover.
I know that the Lieutenant Governor raised the issue of Tabor and how that would affect Coloradans. Explain that to people.
So one of the really big concerns about the Republican health care bill is it cuts more than $800 billion in Medicaid to the states over the next 10 years. And that would leave a $14 billion crater in Colorado's state budget. And with TABOR limits, there's no way that we would be able to come anywhere close to making up that amount, which means we would have to end some Medicaid programs or limit benefits for folks.
But that would also put pressure on our lawmakers as well.
It absolutely would, and it would put pressure on our healthcare providers. In many rural areas, Medicaid covers 28 or 30% of the population. And if they lose coverage, it means that those healthcare providers are no longer going to be able to provide care, or they're going to be providing a lot of uncompensated care, and they'll have to pass the costs on to everybody else.
And where do the huge medical companies out there, where do they fall? What's their role? What is their responsibility in all of this?
Virtually every major healthcare group has come out against this bill. The American Hospital Association, the American Association of Family Physicians, you have the American Medical Association. So many heavy healthcare industry players, both on the provider side, insurer side, nurses, all of them have come out really strongly against this bill.
So what do you say to consumers right now who are sitting, waiting, biting their nails, waiting on the edge of their seats for something to happen? What do you say to them?
What I tell them is this process isn't done yet. As you alluded to earlier, it has to go through the Senate, and it faces a lot of obstacles there. And this is the time when Coloradans really need to be raising their voices. And our senators in particular now need to be hearing from Coloradans about what they want to see in their health care. Because this bill is going to hurt a lot of people if it passes in its current form.
All right, well, we'll see what the Senate does coming up. All right, thank you, Adam Fox. We appreciate you being here.
My pleasure.
Thank you. Up next, big news for the final days of the state legislature. We'll be right back.